Hi, guys, and welcome back to the Rare Wellness Podcast, the podcast designed to help you heal holistically and give you the tools that you need to thrive. We're making it easy to understand medicine and wellness with practical steps from the experts, one podcast at a time. The only thing that we ask is that if this episode helps you live just a little bit better and a little more aligned, that you'll leave us a review and you'll share this with a friend. That's all that we ask so that we can continue to provide you with free, valuable knowledge from the experts of well-being. This is a part 2 episode. I am so excited because pregnancy and labor and delivery and just women's health in general is something that we are not educated enough about. So many of us women go through life not really understanding our bodies, how they work, and especially when it comes to pregnancy, knowing how to prepare for birth, knowing what you're going to be experiencing through all 3 trimesters, how to handle care after birth, how to make a birth plan, so much more. They're just questions that we don't have answered. So today we're continuing our conversation with Dr. Mara. And the previous episode, we went over tips for how to handle morning sickness and fatigue and what you can expect during the first trimester. We went over important things to consider when going through a birth plan. That episode really covers just everything you really need to know, what you need to consider for pre-birth, post-birth, so much more in knowing what setting you want to have it, who's involved, and so much more. Dr. Mara is a chiropractor who specializes in pregnancy, postpartum, pediatrics, and women's health, with credentials including Webster certification, certified birth and labor doula advocacy, ongoing education in palate and breastfeeding assessment, craniosacral therapy, dynamic body balancing, along with working towards her prenatal certification through the ICPA. And she's currently working at the Adjustment Chiropractic in Spokane. Her passion lies in empowering individuals through holistic chiropractic practices and education to take control of their health while creating a safe place to ask questions and be curious when it comes to the norms, not just in the birth world, but in women's health as a whole. Dr. Mara, we're just going to jump right in. So if you guys did not listen to part 1, definitely go back because that sets the foundation for this whole conversation. But we just finished going over things that you should consider when you're coming up with your birth plan. I just wanted to touch really quickly on, I love which we talked about in the previous episode as well, but just questioning the norms. I feel like that's something that's so important when it comes to your health and healthcare. And like you mentioned again in your story of how you ended up in chiropractics and dealing with concussions and so many other things, like sometimes we assume that there's only one way. Like I know even with birth control or period cramps, we're like, oh, I'm going to deal with this pain forever. Like there's only one way and I'm going to be on the pill forever. It's like just questioning sometimes, like questioning your diagnosis, questioning your symptoms, questioning like, is there another way to deal with these stuff? So I just love your approach to healthcare and wellness, and I'm so excited to continue this conversation.
Thanks, me too. Yeah, I'm ready to get after it again.
Yeah. So with pregnancy, normally this is something that just doesn't just affect you. This affects your partner. This affects your family. Like normally this is a journey that you may be the one carrying the child, but there's a whole team that's there with you going through this journey and hopefully supporting you on this journey. So let's talk about how partners can best support pregnant loved ones throughout their pregnancy. If someone's listening to this, maybe to be able to support their wife or their girlfriend better, like what should they know?
Yeah, absolutely. I think having support is such a huge part of pregnancy. So having somebody there, whether it is your partner, whether it is a mom, whether it's your best friend, whoever, whether it's your doula that you just hire to be there to help you along this journey, whatever it is, having some sort of support is huge for the mental and physical because it's such a vulnerable state that you're in during labor and through that birth process and through that transition that we could do it alone, but it's a lot harder if we don't have somebody there to help keep us grounded or help protect us in this stage too. When you're in the labor land of it all, you're not paying attention to what's going on around you. Yeah. And I mentioned that I'm not going to share too many stories about what some different things that I've heard and seen. But one thing is just like sometimes like I said, in a hospital or in a home setting, when you have an OBGYN or a midwife, they have these protocols that they just tend to run through. And
Yeah.
sometimes they don't think to slow down and let you know what's going on and double check in with your birth plan. So having a support person that is there and can like
Advocate.
be truly present and be an advocate is huge. Um, and then also having somebody that can help go to your prenatal visits, can help keep track of these different things with you. They can go to birthing classes with you if you're wanting to do like spinning babies or hypno babies or hypno birthing, like whatever these childbirth education classes are, because especially like in the first and second trimester, third trimester, whenever it is that you're going, pregnancy brain is real, and we're having like so much going on in our body that it can be hard to keep track of things. So having a second set of ears is always nice.
Yeah.
The emotional support too of it all, like just having
Yeah.
someone there that is like a steady person to rely on, and like physical comfort, being able to help with household chores or creating a comfortable environment for you, and just like being able to help postpartum meals is like
Yeah.
such a big one.
Yeah.
So that like support in being able to help run the house when you are recovering from whatever type of birth you had, whether it was a vaginal birth or a cesarean.
Yeah. Well, and I hear you saying there's so many different facets of this. It's like the logistical support of, hey, is your bag packed? Like, do we know the plan? Like, or is the right people in the right place? Like all of that. And then, like you said, the emotional part of pregnancy, and then the like psychological support. Like there's so much. I know it was so funny. One of my best friends just had her beautiful baby boy. But it was so funny towards the end of her pregnancy. She was like, I don't know why people say this is such a magical experience. Because she got huge by the end of it. It was she looked so gorgeous pregnant, but it was so funny. She was like, I don't know why people say this is such a magical experience. I cannot wait for this baby to get. And she was like, to get out of me. And then she was joking with her. They tell the story to everyone, but she was like joking with her partner about like, how has this been? And he was like, well, you're a little bit more irritable than usual, but this is great. So it's like so much changes emotionally during this like time in our lives as well. And like it's so important, I feel like, to have community. That's
Yeah. And I think education is a huge part of it too, because like when you're at this point that you're just like feeling exhausted, sometimes it feels like you just don't even have the capacity to continue to learn for yourself as well. So I actually have a book right here. Hang on. It's on my.
Bring it up.
So for families, if they ever like want just one book for their partner to read, men, it is extremely hot when you take control and are able to help your woman learn more about the pregnancy, and you know what's going on in each process too. Yeah, just do it.
Just do it.
Just do it. This is an incredible book. It is called the Mama Natural book. I also recommend her prenatal vitamins to people.
Can you put it right in front of your face for like half a second, just so I can? Yep, that's perfect. Beautiful.
Perfect. And what it does is it goes week by week to what is happening in your body. It has nutrition guides. She has like a YouTube channel and an Instagram that has a lot of great resources as well. And I just think that this is a really simple, easy book. I mean, it's a little thick for sure, but you've got 10 months to read it, and it goes week by week. So just read 1 week at a time.
I love that.
And it's also an audio book on Audible. That's how I first listened to it, was through there. So you can even just listen to it while you're working out.
I love that. I feel like, again, knowing how to support the people in our lives is just such a beautiful, like the most beautiful gift that we can offer them. And I love what you said. It is very hot when you know what your woman's going through and how you can support her.
Exactly.
I love it. Today's episode is sponsored by Rare Planet Health Supplements. I am such a firm believer in making sure that our body gets the nutrition that it needs for optimal physical performance, brain performance, and overall mood and vitality in life. Rare Planet Health has several different supplements that I have been integrating into my routine and that I highly recommend. But the one that I really want to talk about today is Rise. Rise is a dietary supplement that is a multivitamin, a probiotic, and also is formulated to help boost mental clarity. Whether you're an entrepreneur or you just want to be the best that you can at whatever it is that you're doing in life, this supplement is a great addition to your wellness routine. The bottle is super cute, which makes it really easy to integrate into your routine every morning, and it's designed to help strengthen your attention span with vitamins to help up your mental game, which I think in a digital era, we can all use. By combining a multivitamin and a probiotic, you can combat mental and bodily fatigue with a single supplement. It also provides support for intermittent fasting, improving your energy and productivity while decreasing your food cravings, if that's something that you practice, and has a large dose of vitamin A and B12, which will help your organs, nerves, and red blood cells remain healthy, as well as your skin and hair. The capsules are super easy to swallow, and each bottle contains 60 capsules, which should last you 1 to 2 months. They also offer a premium fish oil, which if you've listened to any of our episode with functional nutritionists and functional medicine doctors, as well as women hormone optimization, fish oil and omega-3s are so important for vitality and a healthy diet. They also have Ageless, which is a stem cell joint and tendon support supplement, and a few more on there. You can get your supplements at rareplanethealth.com and use code RareWellnessPodcast10 at checkout for a discount on your supplements. Again, that's rareplanethealth.com. Use code RareWellnessPodcast for 10% off on your supplement purchase. This podcast is also sponsored by Rare Wellness Med Spa and Wellness Studio. Rare Wellness is a space where you can connect to yourself and get all the tools that you need to thrive and heal and be your best self. Whether you're looking for premium yoga, bar, or movement classes, functional medicine, aesthetic services, massage services, IV hydration therapy, and more, Rare Wellness is the place for you. To get 10% off any service at Rare, use code RareWellnessPodcast. You can book at rarewellness.com or the MindBody app. Lastly, this podcast is sponsored by NWC4RM.com, Northwest Center for Regenerative Medicine. If you're looking to reduce pain and avoid surgery, this might be the solution for you. Get back to the activities you love without surgery with regenerative medicine. Regenerative medicine is a non-surgical orthopedic procedure for joint pain, arthritis, and injuries. If you want to learn more about regenerative medicine and if this might be the solution for you so that you can avoid those surgeries and continue to get back to the activities you love operating at full capacity, go to nwc4rm.com. Regardless of where you are in the country, you can book your appointment there and do an online consultation so that you can see if this is the right fit for you. Receive a free info packet by going to nwc4rm.com and just entering your email, and you will receive more information to learn more. All right, let's head back to the episode.
Okay, so let's go ahead and talk about myths during pregnancy. What are some common myths that you would like to debunk?
I think my least favorite myth is that you can't exercise during pregnancy. And I think that it gets construed so many different ways that like it gets confusing because people are like, you should, you shouldn't, you should continue to work out. You should increase how you're working out. You should change how you're working out. And in reality, like regular moderate exercise is super beneficial for your pregnancy. It can help reduce low back pain. It can help improve your sleep. It can boost your mood and prepare your body for labor and delivery. But one, you should always talk to your healthcare provider before you do anything. But two, knowing what your limitations were before pregnancy too. If you were somebody who had never been in the gym and picking up weights, pregnancy is not the time for you to come out here and try and start deadlifting for PRs and stuff. Continue to do like nice walks every single day. But if you were somebody that was actively lifting in the gym multiple times a week before your pregnancy, then it is 100% safe for you to continue during pregnancy. There are always things like preeclampsia and like high blood pressure or gestational diabetes that should be taken into consideration. So that's why I say talk to whoever your healthcare provider is that's helping you walk through your pregnancy journey with you. But for the most part, there's just like different things that you'll have to modify. I mean, you're not going to be doing hip thrust when you have a large little baby pump there. So just being able to modify different things. And I think that also learning ways to open your pelvis up for labor can be such a huge portion of your movement, especially getting into your third trimester. A lot of people don't realize, but like different movements open up different parts of your pelvis. So we have like our pelvic inlet at the very top, we have our mid pelvis, and then we have our pelvic outlet where baby actually comes out. And so there are different movements that we can do to help open up different parts of these pelvis. And if we're able to do those before pregnancy, when we know if it's a little bit easier if you're doing a home birth, but there are different movements that we can do when we are in labor that help open up those different areas depending on where baby is traveling through at that time too.
Yeah. I feel like movement is one that I'm so glad that you brought up, because I feel like there's so much misconception out there of like, if you lift more than 10 pounds, especially if it's something you were doing regularly before, like it's going to be so bad for the baby. And it's like you said, obviously work with your provider. But movement is always good for you. And I love that. Okay. So we've talked about the birth plan already in part 1, but hospital bag. What should expecting moms pack in their hospital bag?
So they should pack comfortable clothes, a robe, nightgown, socks, slippers.
Mm-hmm.
Make sure you have all of your toiletries, like a toothbrush, hairbrush, lip balm, whatever it is that, like, you might even want to bring like nipple cream and some things if you're planning to stay in the hospital after pregnancy, just for those first few hours breastfeeding. One of my favorite things ever, and like I have never gotten anybody who has said that this hasn't been the best thing that they have bought for their pregnancy, are silverettes. And they're like these tiny silver nipple covers that you can place over your nipples when you're breastfeeding. And they like help prevent cracking because they're naturally antimicrobial. Yeah. But then they also like make sure that your breast or like your nipple doesn't stick to your bra. And it's a lot better than like putting tissue in there, because that can still get stuck and then you have to pull it off. But these, put those in your hospital bag. You can start using them immediately.
I love that. I've never heard of silverettes.
Yes.
I haven't been pregnant yet, so that's probably why. But I love that.
Yeah. I have every single person that I have told to buy them is like, that was one of the best things that anybody ever told me to get during my pregnancy. So
amazing.
10 out of 10 recommend. Important documents like your birth plan, making sure that you have a copy of it, or if you have a doula or somebody else that's coming, making sure that they have it. If you have like this vibe that you want in your pregnancy room, is your doula like bringing the little tea candles, electric candles, and the aromatherapy, or like are you expected to bring that? So if those are things that you have to bring, have them packed way ahead of time. And know what you want to.
I feel like it's so much better to do this before, like figure out what kind of vibe you want while you're still feeling good, and pack it all while you're still feeling good. Yeah, absolutely.
Insurance cards, IDs, making sure that you have like all of that stuff. Don't leave the house without your wallet. Like, but phone chargers, even just buying an extra one and throwing it in that bag. That way it's something you don't have to think about when you're there. If you want photos and like you're bringing a camera, things like that. Bringing items for the baby too. Bring several sets of onesies, a blanket. Make sure you have your car seat installed ahead of time.
Yes.
Things like that. And then if you are somewhere that you are going to be able to eat and drink during your labor and delivery, and that is something that you would like to do for some energy, bring that. And then also if it's not, then like, do you have post-delivery snacks that you're going to have in there too? And then I would also say like a playlist if you want music going, make that. Some pillows, massage tools can be really helpful during your labor too.
Man, this sounds so fun to like prep for. Like it's like such a special day, and you could really make the vibe whatever you want it to be.
Exactly.
So cool. Make it. And I'm such a firm believer. Talking about wellness, one of the ways that I define wellness is like, I think I'm I've realized how much you can make your life magical with like little like wellness rituals of almost like, so this will translate to birth in a second, but like just stopping and taking a deep breath, like in the middle of the day, and like being present for your life, or, you know, say like just sitting down and savoring a cup of tea and like being outside and like looking at the wind moving through the trees, or just like these like little moments that make life magical. Like that really good song that you're playing in the car when you're driving, and actually like being fully present, because I feel like we live in such a like disassociative world and so cerebral, and like you mentioned earlier, like hustle culture all the time, that like pausing and just like savoring life is something that sometimes we forget to do. And so I am like such a firm believer in bringing magic back into our lives, and I think that translates on an everyday basis, but then also like what an opportunity, like you're bringing life into this world, like to like take the time, like make it magical, like bring, like make your playlist, make your like pack your favorite meal for afterwards. Like what an opportunity to invite magic like into life. So that's just like my personal like thoughts, but yeah.
I love that. I also think that that is like such a good thing to bring into it, because having the ability to be present is such a huge thing for birth.
Yeah.
A lot of people, I feel like, would see like the videos or like the movie version of like birth is this super painful thing. And while like it is one of the hardest things we will ever go through as women, it also can't, like, it's not all like that. It has ebbs and flows. And hopefully for most of us, we are not like screaming and pushing for 4 hours like that. But it's also like such a patience and waiting game, and the having the ability to like, you can't control when your baby is going to be ready. It's like, I am very much of a planner, so also it's something that I'm working through, but being able to like know that it's just going to happen when it happens. We're just going to have to go with the flow. And it's not something that you can rush to. Oftentimes I see people being like, oh, I'm just going to get induced so that it just happens quicker and I can plan it. And I'm like, inductions can take 3 to 5 days. It is not like a quick fix to what is going on and like not having progression. Or they're like, I'm just going to get an epidural so that I don't have to deal with the pain. And sometimes epidurals fail. Sometimes they only work on half your body. They're very oriented towards gravity. And like, as a chiropractor too, if there is dural tension in your spinal cord, my personal theory is that that plays a huge role into only feeling it into one side of your body as well.
From what you were saying too, I feel like whether it's during pregnancy or life, like leaning into the fact that we can't control everything, and leaning into like surrendering to like the way that life is going to take its course can be so hard, hard, but it's so beautiful and so rewarding. And I feel like it's like a practice. Okay. So I feel like this is a really good transition into preparing mentally and emotionally for labor and birth. Like we've talked about, like you said, how hard it is to be present sometimes. How do you prepare for this moment?
It does depend. So one, getting to know what your personality type is. And a lot of the preparation comes way in advance when you're like getting together that birth vision. Like, what is this going to look like and how do I want it to look like? And it also comes with birth is so unexpected that we can hold this vision in our mind for months and months and months. But then also there has to be like this disattachment to it as well. Like not having an attachment to a certain outcome. There's always the possibility of needing to go in for a C-section or having to transfer from your home birth and like things not playing out the way that you want. So preparing mentally for like whatever happens is going to happen, and having systems in place for postpartum, I think, is super important. But also leading up to it, there's like other very exciting things that you can do. Like the different classes are huge. I think taking like breathwork classes that are centered around pregnancy, it can be just like one of the most beneficial things. If like you can control your face and relax your face and breathe through different things. Your face plays a lot into your emotions. That same group, I was talking about it at the very beginning of the last part of the episode, Kairos training culture. We did a cold plunge at one point, and the guy that was facilitating, it was in the Colorado, one of the Colorado rivers, and it was freezing.
So beautiful.
But we got in and he was like, what is your face doing? And almost all of us are like, relax your face. Like, what is your face doing? So like having different techniques like that, like calm your face, because that's going to help relax the rest of your body too. Mm-hmm. And if you don't practice these things ahead of time, then like you're not going to use them the day of. So it's not like a quick thing that you can just do a few weeks before you give birth. It's something that like we have to start implementing into our life, which can be really challenging when we're maybe not feeling our best through some of our pregnancy too, or if we are having a really challenging pregnancy. And I've said that a lot, like if we're not feeling our best. Some people have incredible pregnancies. I have a mom that I'm seeing right now, and she's like, this has been like the easiest thing ever. I'm ready to do it again as soon. Like I haven't had any back pain.
That will be my experience of
That's amazing. Good for her. And so I'm like, there's some pregnancy isn't all bad. It's just different for everybody. Really? And it's like not a good thing or a bad thing. It's just what's happening in our body.
I love, like, I feel like detaching like the good and bad labels helps so much with, just in life in general. It's like, however it happens, obviously you want to do the best you can to have the experience that you want, but however life happens, like
always like exactly what you need though.
Yes.
Like even though it may not always be beautiful and it may not turn out like anything what you expected. In our practice this year alone, we had somebody who gave birth to their baby and they were stillborn. And so like it's not all rainbows and butterflies. And so it comes back to like having the support, and like all you can do is prepare, but like in the end you have to have faith in something greater to be able to like get through those more challenging times.
I 100% agree. So moving into, we've talked about how to emotionally prepare for labor. What are the stages of labor, and what can a mom expect during those stages?
So there are 3 main stages of labor that we like talk about. And the first stage of labor is like the longest, and it actually includes like 3 sub phases. So the first stage of labor has our early labor, it has our active labor, and it has transition. So this is like the longest portion. This is most of what people think is labor, is just the first stage. So early labor, it can last from hours to days. Mm-hmm. And when the like stereotypical, this is what early labor is when you are going from 0 to 4 centimeters. And then there's like measurements for how far apart your contractions are to help see where you're at in each of these. There's always going to be some ability, because like some people will go from 4 centimeters to 8 like that, and then it'll take them hours to get from 8 to 10. So these are like rough estimates of like what's going on. But the contractions in this early phase are going to be much more mild to moderate in intensity. They're only going to last about 30 seconds, and they're going to be anywhere from 5 to 30 minutes apart. And it's going to be like the symptoms are going to be like the kind of like back aching. A lot of people tend to describe it as like menstrual like cramps too. And during the first stage, a lot of times is when the release of the mucus plug happens too. And then during this phase, it's just like a great time for you to try and relax as much as possible in between your contractions. Get as much sleep as you can. Continue to get hydrated and like eat, preparing yourself for like energetically for the rest of your labor, because after early labor, we have active labor, which can last anywhere from 4 to 8 hours or even longer. This is when we're going from like those, we ended at 4 centimeters for early labor, and then we'll go all the way up to 7. in active labor, and your contractions are a lot longer and they're a lot stronger. So they're going closer to like 45 to 60 seconds is what they're lasting. They're more regularly occurring, like 3 to 5 minutes instead of 5 to 30. And yeah, it's more frequent. Contractions is the biggest symptom. Being able to tell the difference in those wave patterns. And then this is like when you'll start to see, especially towards the end, when they're getting towards transition, that mom is like dropping into that labor land where she doesn't really know what's going on around her. She's very, very internal and like looking into herself right now.
Yeah.
Because it's helpful. And using breathing techniques during this is changing positions, continuing to stay hydrated and nourished if they're able to at this point, because at this point you're probably at the hospital, or at least towards the end is usually what I say, because we don't want to be in transition to the hospital. But so at some point towards the end of this is where you're going to transfer over to the hospital. And then that is when we have transition. So it is typically the shortest but the most intense phase. And I mentioned like starting to get into labor la la land. This is like when they're fully in it. And for a lot of moms that do home birth, this is typically the portion where like they hit that peak and they'll be like, I can't do this anymore. Transfer me to the hospital. I want an epidural. And this is where you have like those code words. Like if I hear it more than 3 times, then we're doing it. And if I don't hear it while a contraction is going on, then we'll do it. I'm not transferring you to the hospital or getting you an epidural until you tell me when you're not mid-contraction.
Yes.
But, so transition is the most intense phase, can last from like 30 minutes to 2 hours on average. And it's when you're going from 7 to 10 centimeters.
Oof.
So they are very strong, lasting contractions that can last anywhere from 60 seconds to 90 seconds. And it's happening every 2 to 3 minutes. So very intense, not a whole lot of opportunity to rest.
Our bodies are amazing. Like when you think about the fact that we dilate and like that large and then bring a whole human outside of us, I'm just like, this is incredible. Like, it's just incredible. Yeah.
It is absolutely mind-blowing. And just like the ability to withstand, like you hear moms who are in labor for like 72 hours or something ridiculous. And it's like, that is insane. Like, can you imagine those like little period simulators? I want to put one on a man for 72 hours and see how long he lasts.
I know. And I'm like,
and it's not even the same sensation.
It's not. Yeah. I was going to say, even just like, I can't even imagine labor because I'm just like, just with cramps or even like women who experience like endometriosis or really bad cramps, and how many times like women's pain is just not taken seriously. And it's like, oh, they're just cramps. But it's like, it's just wild. It's wild. And I'm also such a huge believer. Like we have so much to be grateful for our bodies. It's like how we look matters so much less than like how we feel. And just to be like so grateful that it's like our bodies are incredible. They really do incredible things. And it's like I feel like unfortunately so much of culture and society has always been like it places such an emphasis on like how women look. But it's like at the end of the day, like if we can switch that mentality from like tearing ourselves apart to like actual awe at like, this body can create a human, facilitate life, and bring it into the world. Like that is insane. And we have so much to be like in awe of our own bodies for. Yeah.
Incredibly grateful. Yeah, absolutely.
Today's episode is sponsored by Rare Planet Health Supplements. I am such a firm believer in making sure that our body gets the nutrition that it needs for optimal physical performance, brain performance, and overall mood and vitality in life. Rare Planet Health has several different supplements that I have been integrating into my routine and that I highly recommend. But the one that I really want to talk about today is Rise. Rise is a dietary supplement that is a multivitamin, a probiotic, and also is formulated to help boost mental clarity. Whether you're an entrepreneur or you just want to be the best that you can at whatever it is that you're doing in life, this supplement is a great addition to your wellness routine. The bottle is super cute, which makes it really easy to integrate into your routine every morning, and it's designed to help strengthen your attention span with vitamins to help up your mental game, which I think in a digital era, we can all use. By combining a multivitamin and a probiotic, you can combat mental and bodily fatigue with a single supplement. It also provides support for intermittent fasting, improving your energy and productivity while decreasing your food cravings, if that's something that you practice, and has a large dose of vitamin A and B12, which will help your organs, nerves, and red blood cells remain healthy, as well as your skin and hair. The capsules are super easy to swallow, and each bottle contains 60 capsules, which should last you 1 to 2 months. They also offer a premium fish oil, which if you've listened to any of our episode with functional nutritionists and functional medicine doctors, as well as women hormone optimization, fish oil and omega-3s are so important for vitality and a healthy diet. They also have Ageless, which is a stem cell joint and tendon support supplement, and a few more on there. You can get your supplements at rareplanethealth.com and use code RareWellnessPodcast10 at checkout for a discount on your supplements. Again, that's rareplanethealth.com. Use code RareWellnessPodcast for 10% off on your supplement purchase. This podcast is also sponsored by Rare Wellness Med Spa and Wellness Studio. Rare Wellness is a space where you can connect to yourself and get all the tools that you need to thrive and heal and be your best self. Whether you're looking for premium yoga, bar, or movement classes, functional medicine, aesthetic services, massage services, IV hydration therapy, and more, Rare Wellness is the place for you. To get 10% off any service at Rare, use code RareWellnessPodcast. You can book at rarewellness.com or the MindBody app. Lastly, this podcast is sponsored by NWC4RM.com, Northwest Center for Regenerative Medicine. If you're looking to reduce pain and avoid surgery, this might be the solution for you. Get back to the activities you love without surgery with regenerative medicine. Regenerative medicine is a non-surgical orthopedic procedure for joint pain, arthritis, and injuries. If you want to learn more about regenerative medicine and if this might be the solution for you so that you can avoid those surgeries and continue to get back to the activities you love operating at full capacity, go to nwc4rm.com. Regardless of where you are in the country, you can book your appointment there and do an online consultation so that you can see if this is the right fit for you. Receive a free info packet by going to nwc4rm.com and just entering your email, and you will receive more information to learn more. All right, let's head back to the episode.
So that was just the first stage.
Oh my word. Okay, that was the first
down
stage.
into 3 little. So first stage of labor includes our active labor, it includes the first stage of labor includes early labor, active labor, and transition.
Yeah.
So now we are almost we're at 10 centimeters. And when we get to 10 centimeters, this is the second stage of labor. And it's when your cervix is fully dilated. It is the same width as your uterus, and baby can come all the way down. And it ends with the birth of the baby. So this is like our pushing stage. It's our second stage. During this stage, it can last from a few minutes to several hours. Again, it just really depends on each person. But it is stronger and regular contractions, very similar to the same ones that you were having during transition. It doesn't feel very different, and they're happening every 2 to 3 minutes. And this stage is what involves actively pushing with each contraction to help the baby move down the birth canal. And then different positions like squatting or side lying, hands on your knees, partner supported holds can be used to facilitate all of that process. In the pushing phase, a lot of times, we see in the videos, the people yelling at the mom to push, push, push.
Yeah.
That is one of my biggest pet peeves. Because my mentor said this in class once, and it has stuck with me ever since. How would you feel If you were in the bathroom, men, taking a poop on the toilet, I'll say poop so that you can publish this online. How would you feel if you were taking a poop on the toilet and somebody was standing over you yelling at you to push?
And that's just a poop. Like, that's not a whole human.
Exactly. Your body knows when to push. Don't try and coach me through it, because then you're going to end up, push. No, I don't need to yet. Like, you know your body, and nobody's going to tell you when to push, when to poop. Nobody is going to tell you to push, when to poop. So don't tell me when to push my baby out either.
That is so good. I say it again louder for the people in the back. Like, that's so funny and makes so much sense. Yeah.
It was like one of the biggest things that stuck with me from chiropractic school, honestly. Don't tell me when to, you don't tell me to push with the poop. So don't tell me to push when I'm pushing out my baby.
I love that. No, that's iconic. I love it.
In the second stage of labor, along with like pushing, this is when the baby will crown. So the head becomes visible at the vaginal opening, and then the baby is born and the umbilical cord is clamped and cut. And at this point is when the golden hour also begins. So the golden hour can be different for everybody. It really depends on like the setting that you're in, the NICU. The most important thing is that at some point you start getting that skin to skin contact. Yeah. However, there is also research to show that as soon as your baby is born, that first hour, having that skin to skin contact right then can be very beneficial for milk production, oxytocin, and bonding. So there are always circumstances that like that might not be possible, but if possible, that is a great time to be able to start that, and then also ask them to do all of their little tests on your baby later on.
Yeah.
And then we're in the third stage. So you think you're done, but you're really not. And the third stage begins after the birth of the baby, because you still have to give birth to the placenta. And there is a big, not like misconception, but oftentimes like everybody's like, oh, this is the easy part because it's the placenta and it's squishy. There's no bones. It'll be really, really easy. But you also just pushed out a whole baby, and it's not always easy.
Yeah.
And also at this point, having skin to skin contact with the baby can be really beneficial, because oxytocin is what helps clamp down the uterus and can prevent postpartum hemorrhage. So that is another reason that I am a huge advocate for skin to skin contact right after birth.
Kind of sucks. Like you just did the hard part, and then you gotta push more out. Like, I think I'm done, and then you're not. So
yeah. It can be anywhere from like 5 to 30 minutes after birth. And if you haven't given birth in 30 minutes, they might need to try and manually remove. Sometimes the placenta can get stuck to the wall of your uterus. But when it pulls away from the wall of your uterus is literally left with this big open wound.
Yeah.
And so that clamping down is really needed. And the contractions are typically much less mild and much less frequent. And then as the placenta detaches from your uterine wall, it comes through your vagina. And then sometimes they need to pull on the umbilical cord a little bit to help get it out too. But it usually is mild. But I've also heard stories where people said that it was almost more painful than giving birth to their baby. So it's like no expectations for anything.
I am just amazed. It's wild how much goes into pregnancy and birth that you don't think about unless obviously you're working with people every day or you're the one who's going through it. But it's just so mind-boggling, and I'm sure we're just scratching the surface. So
even in chiropractic school, it wasn't until I started like reading into birth more, I was like, where does the placenta like actually live? Does it just like hang out in there? Like I didn't even know during chiropractic school, like I didn't fully comprehend. Like I thought there was like, I knew there was an attachment to the uterine wall, but I didn't think about like the fact that it literally has to peel away and leave a giant wound in our uterus. And then our uterus has to like decrease in size after postpartum. So that's been another thing that I added. Fundal massage is something
Yeah.
to decide if you want postpartum too.
What
in
is that?
birth recovery. It is where they will go and they will massage your uterus to make sure that it is feeling like it is decreasing in size.
From the outside.
Yeah, from the outside. But some women say it's extremely uncomfortable and they don't want it. So
Yeah.
something else.
Guys, if you have not listened to part 1, go back and listen. But we talk about placenta and the controversy between should you eat it? Should you not eat it? Should you freeze it? So definitely go back and listen to that. But I did want to ask, back-to-back pregnancy. So you're talking about like this wound that's like left there. If like, is there like a dangerous time frame to get pregnant? Like too close back-to-back, or not?
Yeah, I have not heard of like too close of a time frame to get pregnant back to back. Because your body is going to heal that wound on its own. And majority of people, you won't be able to get pregnant until at least 6 weeks, if not more.
Okay.
For most people, it is going to be a little bit longer. But I will say too, like you don't have to have your period back to be able to get pregnant when you are postpartum.
Yeah.
Just because you haven't had your period does not mean that you aren't ovulating. And I think that's probably one of the other myths is like you can't get pregnant immediately after giving birth. You can once there's no longer a baby in there.
Yeah.
Another one can implant. And as soon as you have given birth, for most people, their ovulation will go back. It might not be a regular cycle and release.
Right.
So being able to track your cycle to see if that's happening. But I have not heard of like an unsafe time, but it's also not something that I have looked into a whole lot. So
yeah, that's fair. I was just curious.
Yeah.
So we've talked about the stages of birth. We've talked a little bit about epidurals and some of the like more traditional pain management things that are administered. But if someone is wanting to go the natural route, what are some natural pain management techniques that can be used during labor?
Yeah, I always suggest breathing techniques. There are a lot of like videos that you can watch on it. I'm sure there's some books. I haven't read any, but I'm sure there are some. And hypnobabies or hypnobirthing is a great one to be able to look up. There, a class that teaches like calm, relaxing birthing techniques and like how to get through like a hypnotic birth, basically. And there's, I don't remember if it's a book or a movie, but it's called The Orgasmic Birth. And it talks about women like actually having orgasms giving birth and like it being an orgasm.
Read that book.
Yes.
Yeah.
So that is another great one that you could look up. I have not personally, it's like on my list of things to read, but it has not made it onto my have read list yet. But I have heard wonderful things about it from multiple other chiropractors and doulas.
The mind and body is so powerful. And I just love that like you can defy what you're like, you can decide what you want. Again, obviously you have to surrender to understand that things don't always go according to your plan, but it's just so cool to like know that there are other ways to approach birth other than this is going to be a painful, horrible experience for me.
Yeah. Absolutely. Yeah. Yeah. We kind of talked about this earlier, but position change is another big one. So being able to have a doula or a birth class or something that teaches you like these different positions that can help open up different parts of your pelvis can be really, really beneficial because not only will they open up different parts of your pelvis, but hopefully they can also put you in a position that you can start to relax in a little bit, especially in those earlier stages of labor. And they might help release discomfort having like different positions that you can like the hip holding or the hip squeeze, whatever you want to call it, different techniques that your partner can even do to help alleviate some of the stress during pregnancy. And then hydrotherapy is another big one. A lot of people for home births, or if you're giving birth in a birth center, will have like the birthing pool. But if you're in a hospital, a lot of times they'll have a shower in your bathroom. And if they have one of those like detachable shower heads, having somebody that can like rub the warm water over your back using the shower head can be really helpful too. Massage, gentle like counter pressure, different trigger points, somebody that can help you with that. And aromatherapy is another big one. That's why I mentioned like the essential oils and the diffusers, bringing all that. If that's something that like you have a very strong connection to already in your day-to-day life, it might be something for you to have moving forward. And it's like the whole thing when we were kids, like, oh, I chewed this gum while I was studying. So like, I'm going to chew this gum, that brain body connection, like while I was preparing, doing my exercises, doing affirmations to myself. Things like that. I had this one scent going. You then bring that into your birth room, and that has really powerful effects on the mind too.
I love this. So without going too deep into it, because I feel like this could be like a whole nother podcast episode, just like a quick overview, postpartum care. I would love to do another episode where we just go deep into that, because I feel like there's probably so much to talk about. But like, what should a new mom focus on after giving birth?
Yes. Yeah, you're right. I could go into a rabbit hole, because this is something too that I feel really passionate about sharing with my moms in practice, because oftentimes, like, as soon as a mom gives birth, we tend to shift the attention from mom to baby. And mom tends to get forgotten about, and like not in like a bad way, but like, oh, she's given birth, she's fine now. And like the traditional medical system of checking up on her at 6 weeks in 1 year just isn't enough. And too many people have like postpartum depression that isn't caught, or postpartum psychosis that isn't caught, because we don't know how to look for these things. And we also don't know how to like emotionally support people and start to see those changes. Like, how do we know if it's just some baby blues and needing some emotional support versus when is it actually like postpartum depression or postpartum psychosis? So I could go on to that for a lot, but some of my biggest tips are like rest and recovery, allowing time for physical healing. There are like certain cultures, and one of my friends actually just did this with her baby. She gave birth, and then for 40 days, her mother and husband did not let her, like, she wasn't allowed to leave the house. She wasn't allowed to cook. She wasn't allowed to clean. Her only focus was to bond and rest with baby for 40 days.
Beautiful. That is so beautiful.
Granted, I will say around day 30, I think she snuck out and came to the park to get some sunshine, but it wasn't like she was doing anything, everything. Like just moving low and slow, and like having time to connect with her baby. And building that bond.
Beautiful.
And getting used to being a mom, because it was her first kid. Nutrition, eating a balanced diet to support, and like for breastfeeding recovery, it's really important to eat like warm, nourishing foods postpartum. I have this like company that I was working with when I worked in California as a chiropractor, and her name she goes by the Kitchen Doula, and she now ships to Washington, so people here. And she helps cultivate postpartum meals for moms.
That's
and
beautiful.
So it's like a great thing that I recommend that people put on their registry. And it's nice for a family that lives far away, because you can order food, and that is like one of the biggest things that a mom needs, but also is a huge support when she doesn't have to worry about cooking another meal that night. Especially if she's got multiple kids too. Emotional support, we've talked a lot about that. Physical activity, like slowly getting back to things, being able to go on a walk, or like even if it's just like sitting outside. Also knowing when physical activity for you is going to feel best is huge. Breastfeeding support, taking time for some self-care. And then another thing that I just like to bring into postpartum for me personally as a chiropractor is learning what diastasis recti is, having somebody that can help you evaluate it and work through it if it is something that you are experiencing.
Man, I have so much, Dr. R, we're going to have to talk about doing this again another time and just diving deep into, because I could ask you about breastfeeding. We could talk about, just dive into like each area of this, like so much more. So for people who are listening and they're like, this is all such good information, I want more resources, I want more support for my journey. Do you have some resources that you recommend? Where can they find you? I know you mentioned a book earlier that was great. all the things.
Yes. So one, I am a huge advocate that every single mom, if they have access to and are able to, they are under chiropractic care, because a lot of really great pregnancy and pediatric chiropractors are going to have so many of these resources. Like, I'm a pretty new doctor, honestly. I've only been in practice not even a year.
You're very knowledgeable. So
the people that have been in it way more than I have and like have been surrounding it probably have just as much knowledge as well, if not more. And so finding a great chiropractor, there's a website called the ICPA, International Chiropractic Pediatric Association. And I always recommend that people use that to help find chiropractors in their area. And then because it filters it by their certification. So you can find somebody that is Webster certified, which is the specific technique to help balance your pelvis during pregnancy. And then I also recommend that they kind of reach out and see what other areas this person has expanded in, because not all chiropractors are built equal. And I'm also a big believer that just because somebody has a Webster certification doesn't mean that they're a pregnancy and pediatric specialist. So that would be my first recommendation, finding a great chiropractor to help take care of you throughout your pregnancy journey. Finding as much resources as you can. The Mama Natural, here it is again, is another huge, like very beneficial resource that I feel like if you feel very overwhelmed and stressed and you don't know where to start, you don't know how to look into everything, this is a great book to just like help you take it day by day and step by step without it feeling overwhelming and like you have a million things thrown at you. Spinning Babies is another great website that I think everybody can benefit from. It is about just like different laboring positions, and it talks a lot about breech babies. So if that's something that you're experiencing, their website can be really helpful. The other one that I would really recommend is Evidence-Based Birth is a website, and they have some great statistics that you can look at and go on there, and all of these different things that we talked about, like vitamin K or Hep B, or even just different birth interventions like ultrasounds or epidurals or things like that. You can go in and kind of look through their stuff and different research articles that they have.
That is so helpful. And also, if someone wants to reach out and book with you, where can they do that? And where can they find you? Your Instagram handles, all of it.
Yes, they can reach out to me on Instagram. So my Instagram is Dr. Mara Trowbridge. We also have a business page called The Adjustment Chiropractic that you can reach out to us on there. And our website is linked in my bio if you wanted to book with me, or just like contact me. I think my email's on there too, but you can just shoot me a DM on Instagram.
It's amazing. Dr. Mara, I am just so grateful that you made time to do this with us. I learned so much. I just know that when I'm like pregnant or wanting to get pregnant, I'm going to be listening through these and learning so much again, and also reaching out, because I just love your approach to pregnancy, to labor and delivery, to the way that you approach knowing what's right for you and all the different options out there. So you're incredible. Thank you so much. You're so knowledgeable. I'm so grateful to have you on. Yeah.
Thank you for having me. It was great. It's just like nice to be able to talk all of this out too, and like
100%,
share even just like the little bit that I know, and like allow people. I think that we so often live in a place that like we don't trust our body too.
Yes.
So like trusting our body and being able to tap back into our innate intuition, innate wisdom, and just educating people, because there's so much of this that if we just knew more, I feel like the more we learn about our bodies, to me, I'm like, the more we can learn to trust them, because we'll understand how incredible they are. So if you guys are listening, be sure to subscribe and turn on your notifications. And if you're listening to this on Spotify or Apple Music, we do have a version out on YouTube with video. So go on there as well, and then you'll be able to see the books that Dr. Mara was like holding up through the episode, and so much more. We'll see you guys next week. Bye.